Hi everyone, Matt Seabrook from Dresher PT, and today we're going to talk a little bit about your rotator cuff. So I have a shoulder model here. Let me show you around the block a little bit. So this is a right shoulder. This would be your shoulder blade or scapula. Over here is your humerus or your arm bone, and up top is your clavicle. So the rotator cuff, if you've heard of it, is a group of 4 muscles. They attach on your scapula and they run out and attach on the other end to your humerus or your arm bone, and they can either rotate your arm in or out, or up and down up here, or it helps elevate your shoulder for a bunch of functional purposes that we use every day for. So when we see problems in the clinic, one of the more common problems we see of the shoulder is a rotator cuff tendonitis or an impingement syndrome. And so what happens is the tendon or tendons of your rotator cuff can start to get pinched, and one of them particularly can get caught in this tiny little space up in here. These are ligaments shown here. There are no muscles shown, but the muscle and tendon underneath can get pinched. And that can start an inflammatory process. It can cause pain. It can cause a reduced motion, and certainly can reduce your function. So there's a quick test that you can do at home to say, hey, could I possibly be, I am having some shoulder pain. Is this a rotator cuff issue? Simple test. One of the things we ask people to do is take your good arm and go all the way up your back. See how far up your back you can reach. Feel what that feels like. And then try it with your other arm. If you experience pain or reduced mobility or just a stiffness or tightness compared to the other side, it's a very good chance you're having a rotator cuff issue. And that's what people tell us most often, is they have an issue with going behind their back, or they have an issue sleeping on that side, or they have an issue reaching up overhead or out to the side. That's a really common thing with rotator cuff. So if you're having a shoulder problem and you're not sure what's going on, you want to shoot me an email. It's matt@dresherpt.com, or certainly you can put shoulder pain or rotator cuff problem in the subject line. Let me know a few things maybe that is making the problem worse, or maybe even making it better, and hopefully I can help you. If you feel like you need to come into the clinic, certainly give us a call. We're available for that as well. Hope this video is helpful. Have a great day.